Today's presentation is Cognitive Psychotherapy for Breast Cancer Survivors. I'm, she mentioned, in Dr. Poole's last term of evidence-based practice, which you guys will be doing this next semester. And this is my final capstone project. So this image here kind of gives you an idea of what I'll be talking about. It shows that physical sensations and thoughts lead to our emotions, which lead to our behavior, and then physical sensations, and then it just goes in a circle. So some important breast cancer facts to keep in mind, I will be quizzing you later, is that breast cancer is the most common cancer affecting women all around the world. Women with breast cancer have twice the prevalence rate of insomnia versus the general population, and these women have an increased rate of depression, anxiety, insomnia, and reduced quality of life. About 40,000 women die each year from breast cancer in the United States alone. Now we're going to be talking about treatment options for breast cancer. Depending on the type and stage of breast cancer, and if it has spread and how much it has spread, will determine the type of treatment. And often more than one treatment will be used for a woman diagnosed with breast cancer. They could have surgery, which of course is when they cut out the cancer cells. The doctor could prescribe chemotherapy, which could be sub-Q, IV, or oral, or both, or all of the above. They can have hormonal therapy, which blocks the cancer cells from getting the hormones they need to grow. A lot of times they'll also order biological therapy, which works with the body's immune system to help fight off the cancer and prevent it from growing. Or they can have radiation therapy, which uses high energy rays similar to X-ray, and that kills off the cancer. And then lastly, alternative complementary therapy, such as cognitive psychotherapy, which is what we're going to be talking about, or sometimes CBT, it's also known as cognitive behavioral therapy.
Sorry, it's too dark.
So does anyone know what cognitive psychotherapy is before I get into it? Or any ideas?
Talking about and expressing your feelings.
That's good. Anyone else?
Positive thinking.
Yes. So cognitive psychotherapy is also known as CBT, or cognitive behavioral therapy, and it's therapy and interventions that are implemented to help change one's thoughts from negative to positive. And it can also decrease pain, anger, anxiety, and depression. And some interventions that include this are support seminars, sleep education, and relaxation techniques or interventions. So this is the CBT triangle, and it begins with our thoughts, our behaviors, and our emotions. So what we think affects how we act and feel, which leads to our behavior. What we do affects how we think and feel. And our emotion, what we feel affects what we think and do. And it's just a vicious cycle. So why is this important? Why is cognitive psychotherapy important? This offers nurses an alternative intervention for breast cancer patients when it comes to dealing with their emotional impact that they have from the diagnosis, using state-of-the-science evidence-based practice. So then I come to my PICO question. Can anyone tell me what PICO stands for?
Population, intervention,
Comparison, outcome, and time.
Very good. So my PICO question was, in women diagnosed with breast cancer, how does the use of cognitive psychotherapy compared to not using cognitive psychotherapy affect the overall quality of life within the first year of diagnosis? So then I conducted a literature review for this capstone project using the school's online library database, specifically SINHAL and the Cochrane Database of Systemic Reviews, and I looked for professional nursing journals that related to my PICO question. So my first study was an article from 2007 by Epstein and Dirksen, and it was a randomized controlled trial of cognitive behavioral interventions for insomnia and breast cancer survivors. This was a level 2 level of evidence, which is pretty high, and the sample was 72 women who completed breast cancer treatment 3 months prior to this study. The aim or purpose of the study was to determine the efficiency of CBT interventions for treating insomnia, with the main research variables of sleep onset, wake after sleep onset, total sleep time, time in bed, sleep efficiency, and the total quality of sleep overall. Their method was they had a random assignment of one group, which was the control group, had only a single component of sleep education hygiene, and then the other group had multi-component interventions such as stimulus control instructions, sleep restriction, sleep education, and hygiene. My second study was a systematic review of 28 RCTs, which made it a level 1 level of evidence, and it had a pretty large sample size, 3,940 randomized participants, all of which were women. And the aim of this study was to assess the effects of cognitive psychotherapy, or CBT, on the quality of life among breast cancer survivors. So the CBT model, like I mentioned earlier, my mood and emotions influence my thoughts and actions. My thoughts and actions influence my quality of life, and the quality of life influences my mood and emotions. The main research variables that they measured here were anxiety, depression, mood, and overall quality of life. So then I found another article with guidelines, recommended guidelines from the National Guideline Clearinghouse. This article was in 2013, and it showed the different types of interventions that they recommend. Music therapy was shown to decrease anxiety during chemo and radiation. Meditation improved mood and decreased depression. We had stress management groups that showed a decrease in stress levels, and it taught relaxation techniques. Education on energy conservation managed fatigue and improved sleep quality. Yoga improved mood overall, and sleep hygiene enhanced total sleep time. So what was the conclusion of study 1? This multi-component group's rating of sleep improvement was significantly greater than the control, which only had the one intervention. The time to fall asleep, amount of time spent awake during the night, total sleep quality, these were all within good, the P levels were all low for this, and the reliability of the instruments, they used a wrist actigraph to measure sleep, and sleep diaries. The Cronbach score for this was 0.79, which is acceptable, that shows that it's a reliable instrument. And in conclusion to study 1, a non-pharmacological intervention is effective for the treatment of insomnia. For the conclusion of study 2, the pooled standardized mean differences showed less depression by 95%, confidence intervals for depression, anxiety, mood, and mood. Quality of life had the lowest quality of evidence with a P equals 0.03. So in conclusion, cognitive behavioral therapy showed significant improvements with depression, anxiety, and mood. However, the survival rate and the quality of life needed more research. And then these are my references. So now I'm going to pass out